Well, Adrian was just talking about disarray for some parties, and some might say that we have that in our healthcare system. Alarms have been sounding right across the country that ICUs and our healthcare workers are being overworked and burned out due to the pandemic. So it's going to be incredibly important for this next leader, Justin Trudeau, to really bring people together and also to take a look at the hard facts when it comes to our healthcare system. So let's pull in Dr. Quam McKenzie, who's joining us from Geneva. So I just want to say a shout out to him for staying with us early into his morning. What did this pandemic expose when it comes to our healthcare system, and how does it need to function post-pandemic?
Well, I think there are loads of things that we know that we've got to do with the healthcare system. I mean, we need to deal with the backlog of care that's happened because of COVID. We're going to have a staffing problem because nursing and doctors shortage because we've got so many people who've burnt out. But actually, through COVID, there's been a nimbleness to the health service and some innovation that we also need to keep, like the move towards digital care, which is going to be important. But then I think after that, we need to take a deep breath and we need to rethink, because we've got a lot of things to think about and a lot of problems to fix that we had before COVID. We need to focus on decreasing health inequities. I mean, before COVID and still now, we've got populations like the racialized populations, indigenous populations, and low-income people who get worse healthcare, worse outcomes, and worse access to healthcare. We have to properly fund mental health and substance use treatment. We've not done that before, and not surprisingly, we've got problems there. And then we need to focus more on prevention because we've really got a illness service rather than a health service. And it would be great if we could ensure that our social policies dovetail with our health policies so that we try and keep people well.
Professor Hardcastle, this really opens the question. We've seen the gaps in our healthcare system to privatization. What are your thoughts on that?
Well, I think that with the election of a Liberal government, it'll be interesting to see where they take the healthcare system and the Canada Health Act, and will they expand it to the much needed pharmaceutical services, dental services, the things that are truly medically necessary. Right now, we really focus on hospital and physician services. So I'd like to see an expansion there. I wonder too whether they will stick by some of the discussion around cracking down on provinces who allow privatization to creep in and to allow a greater role for the private sector. On the other hand, I think that we had heard from Mr. O'Toole, we had heard discussion around allowing provinces that greater room to innovate and perhaps some erosion of the Canada Health Act.